Hello everyone! Welcome back to my channel. So for today's video, it's all about me sharing my experiences during the childbirth of our dear baby boy. And this is for all the new parents and just everyone else who's curious about the process of childbirth here in the UK. So if you're still interested, just keep on watching and please don't forget to subscribe. Okay, so before I start, I want to give a bit of a disclaimer here. This video tells only about my story, just to give you an insight on how it is to give birth here in the UK. The NHS provides appointments, checkups, antenatal classes and breastfeeding classes, and a lot of handouts for us to prepare in labor and delivery. Alright, so here's my story. I gave birth past my due date. My ETD or expected date of delivery was supposed to be March 8, pero nag-start lang akong mag-labor March 11. March 11 at 11 a.m. was supposed to be my 40th week antenatal checkup. 2 a.m. I found a blob of blood-like discharge inside the toilet bowl after I passed urine. And it happens to be my mucus plug, or the so-called CHO. No contractions at all. 6 a.m. I felt a trickle of fluid from down there, and I felt like my pad was moderately soaked, and the color of the discharge is more pinkish. Still no contractions, but then I decided to ring the ward, inform them about the situation, and then they just reassured me that it is normal, just to keep on monitoring and push through with my appointment at 11 a.m. Okay, so appointment time 11 a.m. I went to the hospital. Full assessment was done, and then the midwife confirmed that I already have a rupture of membranes, or my water already broke, but still I don't have any contractions. So ang advice sa akin, umuwi muna, continue lang to monitor, especially the contractions, and then bumalik or tumawag ulit once I felt na continuous na yung contractions, regular, strong, and lasting more than 60 seconds, or until 6 a.m. the following day. Kasi yun na yung 24th hour since pumutok na ang aking panubigan. So I went home, and then tinuloy-tuloy ko lang ang pag-monitor for contractions and syempre other untoward symptoms. For the whole 24 hours, wala akong naramdamang contractions, nothing at all. I even had a good night's sleep. So, March 12 at 5 a.m., I rang the ward, and they finally asked me to go back to the maternity assessment suite. So the hospital allows us to bring 2 birth partners with us to stay with us during the labor and delivery. And so I brought along Mom and Ken, and then I also brought my hospital bag. We arrived at the maternity assessment suite at 6:30 a.m. We waited for the midwife, and then full assessment was done, and she also did an internal examination down there just to see the condition of my cervix, and of course my baby was also monitored via the electric fetal monitor machine, or what we call CTG machine, and then it lasted for a couple of minutes. So after the assessment, the midwife discussed with me the risk and benefits of induction of labor. The reason for the induction of labor is because I bag of water already booked more than 24 hours now. There is a great risk for the possible infection for me and my baby. So yeah, my labor was induced using a tablet or pessary containing hormone called prostaglandin, which was inserted into my vagina. After that, I will be monitored in the hospital for 6 hours. So I was brought into the postnatal ward because at that time, the labor rooms are full and I have to wait for 4 hours till I can be transferred to the labor room. So there, a team of midwives visited me and explained to me the plans, and I was put on another electric fetal monitoring of my contractions and my baby's condition as well. For the first hour after the insertion of the pessary, I was okay. I wasn't feeling so many contractions. There were mild contractions building up, but it was okay. It was bearable and it was very irregular. Later on, it starts to build up. The contractions are getting stronger, more frequent, more intense, and are lasting more than 60 seconds. I had this app which I used to time my contractions, and then it got to a point where it was really unbearable. Pain score from 1 to 10 would be 10 out of 10. Given my low pain threshold, it felt like it was very intense that I wasn't able to bear it. I tried my best to calm down and use all the relaxation techniques that I've been preparing for months, but I was not winning, of course. Halos kumapang ako sa sahig. Ganun yung feeling. Hindi mo alam kung saan mo ilalagay yung sarili mo para maging komportable ka. And also, I have this frequent urge to go to the toilet because it feels like I want to poop. But hindi yun yung nangyayari. Hindi yun yung nararamdaman. And it was really intense at that time. As expected, induced labor is more painful than the natural spontaneous labor. But I didn't know, or I have no experience with natural birth yet, so I could not compare. But it was really painful. The midwife checked me every now and then, tried to give me positive encouragements and support, until it got to a point when I was already crying. It feels like I am in no control. 2 hours more of waiting and I'm already very exhausted, soaked with sweat. I was lucky that I have 2 birth partners with me, and feeling ko nadudurog ko ng kamay nila dahil sa pagkapit ko sa kanila. An internal examination again was done and found out that I was already 4 cms dilated. I was given paracetamol at that time, which it totally didn't work. I was asking for a strong pain relief. Since I wasn't in the labor room yet, I couldn't have the epidural because it should be given under the observation of an anesthetist. So I tried my best to push through or go on with that pain, but it was really intense. So past 4 p.m. the labor room was ready. I was transferred there. The anesthetist was already prepared and waiting for me. So she briefly explained to me the risk and benefits of the epidural. After I agreed, she already prepared the materials to be used. While waiting, I was given this gas and air, or the medically known Entonox. So it's a mixture of oxygen and nitrous oxide that is breathed in through a mouthpiece, which was just there on the bed. So I used that. Breathing through it felt funny. I felt lightheaded. I felt very drowsy. It felt like I was drunk. It didn't really took away the pain, but it acted more of a distraction, because you're feeling the pain, but then you're feeling like you're not yourself. So while waiting as well, an IV line was secured to give me fluids. The anesthetist was ready. I was on a sitting position when she gave me the epidural. My birth partners assisted me to the position so that the anesthetist has a proper view of where she should insert the needle. So the needle was really big. I didn't see it, but I know how it looks because I've assisted with epidural anesthesia before. The thing is, I didn't really felt how she inserted it. I don't know if she injected a local anesthetic first before inserting the needle, or I was too dazed with the Entonox, and I have another more serious pain that I didn't really felt the needle. But she administered it very quickly, and it worked almost instantly for me. It is a patient-controlled epidural analgesia, wherein the epidural is attached to a machine that is connected to a button. So the button is for me to control. It means that I am in control of my own pain relief. I can have the anesthesia anytime I want, for as frequent as every 15 minutes. So a monitor is monitoring my vitals continuously, and as well as an electric fetal monitor again for my baby and my contractions. I was also lying on the bed because again, it's an epidural. It felt like your whole lower body is not with you. That's how you feel. If you close your eyes, like, you won't feel any part of your lower body, but you can move it. So it's kind of weird. It felt weird. They inserted a urinary catheter to drain my urine from my bladder. 8 p.m. I was already 5 cm dilated. Waiting game. We were able to have a quick nap while waiting. I was fully relaxed, totally relaxed because of the epidural. 12 midnight, 8 cm dilated. We were really optimistic at that time. I'm about to give birth soon. I was already mentally preparing myself to push. The plan is at 3:30 a.m. the midwife will do another internal examination to see how dilated my cervix is. While waiting, I felt sick. I'm not sure, but it probably is from either the gas or the epidural that I kept on pressing. So I was given antiemetic. The nausea and vomiting sorted. So 3:30 a.m. internal examination was done, and she found out that my cervical dilation slowed down. My cervix was still only 9 cm dilated. So she said I will be monitored for another 2 hours. So yeah, still feeling positive after that and hoping for the best. So 6 a.m. she did another IE or internal examination, and there was no progress, sadly. My cervix was still 9 cm dilated. To make sure, she asked another midwife to check on it, and she said the same thing. Based on her assessment, it was just a small portion of cervix that is on the way. So she will help me, and then we can do the trial bear down or trial push. She will help dilate the cervix from down there, and I will push and see if it works, and then we can proceed with a normal delivery. So we did, with all my strength, with all my knowledge, with a proper bear down. Just after 2-3 attempts, we stopped. And then she did documentations and all. She then discusses the possibility of a cesarean section. We waited for a bit more. So by past 8 a.m., a team of OB and midwives arrived in my room, and they did a full assessment and internal examinations again, read through my charts, and then plan was to deliver the baby via assisted birth. Assisted birth using a forceps, and then if it is not successful, we will push through with C-section. So these things will be done aseptically or in a sterile manner inside the theater. I am still hoping that I wouldn't have the C-section. So my husband and my mom helped me to calm myself. I was beginning to be anxious at that time, but I'm trying to pull myself together. I was trying to focus my thoughts on doing my best to bear down and deliver my baby via assisted delivery. I was hoping that the forceps delivery would work. I was brought in to the operating theater after it was prepared. My husband went in there with me because it's a sterile area, so he had to change to scrubs. Working as a theater recovery nurse for so many years now, I have seen the setup in the operation theater a lot of times. But then, when I was brought inside the theater, when I saw so many people, which is of course expected, I felt very anxious. It really felt different once you're in the shoes of the patient. Even though I am confident they can do it, I felt so scared. Even though I have the full knowledge of how a C-section surgery is done, I still am in denial of the fact that I probably will go for a C-section. I tried to pull myself together really hard. My husband was great. He was very helpful when it comes to mental and emotional support. And also the anesthetist, it really is a big factor. If your anesthetist has this really caring, calm nature, it kind of helps you relieve your anxiety. So when they transferred me to the operating table, my anxiety began to be symptomatic in terms that my whole body was literally shaking. Everyone was asking me if I was alright. I was smiling, but literally deep inside I was really anxious. I was given a top-up of the epidural anesthesia, so the anesthetist explained to me that it probably is the medication that's making my body shiver. But I believe that is a mixture of the medication and my anxiety. I was positioned for the forceps delivery and everyone's ready. So I tried my very best to focus on bearing down. And with the surgeon's signal, I pushed as hard as I can. I couldn't feel anything from down there every time that I'm bearing down. So I wasn't sure if I'm doing it right, but they say I'm doing well. He was assisting from down there using a forceps to assist me with my birth. After a few attempts, I think that was 2 to 3 attempts of bearing down, OB decided to stop as he saw that it was not possible. So he said that we will proceed with the C-section. My anxiety was this high. So my husband said, "You did well, it's okay, you can do it. Let's get this done now." The anesthetist was lovely as well. I felt sick again and I threw up. I was given antiemetics. So since the epidural is already available for me, they just have to top it off and I'm ready for the C-section. C-section was commenced. My husband was beside me. I was awake, but I felt really drowsy. My whole body was still terribly shaking. It went on and on all throughout the procedure. And I also threw up, I think, 2 to 3 more times during the surgery. More antiemetics. I never had an operation before. I was never hospitalized before. And that was my first time. It was a totally new experience for me. My lower body was numb. I don't feel any pain, but I feel movements in my stomach. So I think that was the reason why I felt sick as well. My head is lower than my foot. I think that made me felt sick as well. 10:06 a.m. my baby boy was delivered. My husband was able to look into my opened abdomen. It was like a celebration. Everyone was congratulating us. I can recall the surgeon even mentioning, "Oh, look at the size of this baby." And right there and then I knew he was a big baby. Honestly, during that time, I was happy, yes, but I felt very dazed. It felt like I was disconnected from everyone. Felt really drowsy. I was really trying my best to stay awake, but I failed. I had few glimpses of my baby when he was born. Soon after, I gave in and fell asleep. After the cord was cut, my baby was brought to the newborn warmer where the neonatologist assessed do the initial newborn assessment and care, and they gave the vitamin K. My husband also told me that soon after the baby was pulled out from my abdomen, he started to poop. And we were very lucky that he pooped after he was out, because again, that is a risk for infection for both of us. My husband at that time had the privilege to cut the cord. Our baby was very big. He was weighing 3.8 kilograms. Baby was then brought to me for skin to skin, but I was asleep at that moment. So my husband held my baby and he did the skin to skin. Yeah. Meanwhile, due to the new COVID restrictions, they only limit birth partners to just one. So by the end of the procedure, my mom was asked or advised to go home. After the procedure, I was still very drowsy. They started preparing me to be transferred to the recovery room. My baby was put into my chest. And that was our initial skin to skin. I was really happy, but then I still feel very drowsy. We were transferred to the recovery room. In the recovery room, I was monitored for a couple of hours. Initially, I was sleeping, and then when I felt more awake, again, the baby was brought to me for skin to skin. And then as early as that time, I was encouraged to breastfeed my baby. So yeah, I did. I was given support on how to do it as well. It still is a first time experience for me, so it's a good thing that they are helping me. I was fed with toast and tea once I was more fully awake in the recovery room. Yeah, I enjoyed my time with the baby. Then when I was fit for discharge, I was sent to the postnatal ward. The labor room, recovery room, theater, and postnatal ward are all in a huge department. When I was fit for discharge, I could not forget, I was asked to walk from the recovery to the postnatal ward. It's a funny thing because the nurse was trying to take my baby, and then I said it's okay because I can have her with me while I'm being transferred to the ward. And then she said, but you're gonna walk. And I was shook. I'm gonna walk? I was meaning to say that I just had a C-section and I had epidural anesthesia for a long time, and you're just gonna ask me to walk. I was like, okay. And then, yeah, I am a recovery room nurse, but I never even experienced asking patients to walk straight after a major surgery. Yeah. Even thought that I was in the recovery for a couple of hours, but even my husband was shocked. I set myself up, I stood up and walked, and I did. The recovery room was not too far from the postnatal ward, so yeah, I thought I was going to be dizzy. I did not felt dizzy at all. So the thing is, you really can move around which is a good thing. It helps my blood circulation since I was lying on the bed for so many hours. We stayed there overnight. I had no issues with pain because I have this round-the-clock pain medication that they were giving me. I have no other problems, no complications at all. My midwife checks on me in a timely manner. I was also given support for breastfeeding. Then the following day, they were convinced that the baby is feeding well and I was doing well. So me and my baby were discharged from the hospital. That's just how quick it was. Yeah, I could never be more grateful for the whole team that was there who attended to me at that moment. It was a very exhausting, emotional experience. I just had a great admiration for all the mothers at that time, realizing how difficult it really was to bear a child out of this world. We have really a different story of how we gave birth. We have really a different pain threshold. We have really different experiences. But I'm sure it was one of the most challenging moments of every mother's, but also one of the happiest. I just was so lucky that my mom was there with me, and I am even more lucky that I have a great partner with me during that very difficult or challenging time. There are even more challenges once your baby is out. Parenting is another different level, but I think that was the moment when you flip on a new chapter of your life, and that is how I felt. I could never be more grateful to the whole team who took really good care of me and my baby throughout that time. So yeah, that is my birth story. I hope you learned something from it, and I hope you had a good insight. I will post another vlog about what happened, or the discharge procedure, and the first few days post-operatively, because it's another story to tell. I hope you guys enjoy watching, and again, please don't forget to subscribe. Thank you very much. Bye.